Hello, I'm Dr. Guru Prasad Shetty. I'm the lead HPB and liver transplant surgeon in Apollo Hospitals, New Bombay. Today we are discussing symptoms and signs with the onset of liver disease. Primarily amongst this, which we commonly see are jaundice. It's a very common symptom seen in all patients with liver disease. It could be of a mild nature or it could be of a very severe nature. The patient commonly notices a change in the color of the urine, usually of a darker nature, yellowish and dark in nature. Or someone in the family could also notice that there is yellowish discoloration of the eye or the sclera, the white part of the eye. This needs evaluation immediately and needs an expert assessment in terms of a gastroenterologist or a surgeon seeing the patient, because there are multiple causes of jaundice that need to be ruled out, whether it's a viral infection, a bacterial infection, it could be liver tumors, it could be a chronic alcohol abuse. All this needs to be ruled out immediately, so the patient needs to visit an expert. Associated symptoms along with jaundice could also be fluid filling in the abdomen, which is medically called ascites. This is because the abdominal walls are lax and there's a potential for a large amount of fluid to collect over there. This fluid is primarily produced because the liver is not able to synthesize any proteins that is ingested in the diet. So albumin, the quantity of albumin made in the body is low, and because of that, fluid which is supposed to be in the blood vessels leaks out into the abdominal cavity. The other potential spaces to collect fluid is also in the chest, which is called pleural effusion, or just in the limbs, where you primarily see edema in the hands and legs, or the patient may just present with swelling. The treatment for ascites or edema is usually medical in nature. It requires some amount of diuretics. But if it's causing distress to the patient, then fluid from the abdomen or chest can also be removed by tapping. Other symptoms that the patient may present is vomiting of blood or passing dark colored stools. This is because of rupture of blood vessels in the esophagus or in the food pipe. This happens because of underlying portal hypertension. This needs immediate attention again to control the source of bleeding, and this is done by using an endoscope or a colonoscope. Other symptoms that the patient may present could be confusion, which is usually called encephalopathy in medical terms. This could either be a mild nature where the patient may just be confused or maybe incoherent, to an exaggerated nature where the patient may be deeply comatose and requiring intensive care support. This is because of a buildup of ammonia in the blood. Ammonia builds up because of undigested food or presence of blood in the digestive system, and the liver is not able to metabolize it, so the blood ammonia starts rising. This again is of an urgent nature where the patient requires hospitalization to lower the levels of ammonia in the blood. Other associated symptoms with liver disease is one specifically called sarcopenia. Sarcopenia is the loss of muscle mass in the body. You could have severe thinning of the limbs, upper limbs and the lower limbs. This is again because of loss of protein synthesis, and the patient is not able to keep up his muscle mass in the body. Kidney can also get affected in liver disease. This is called as hepatorenal syndrome, where the patient's urine output drops or the creatinine starts rising. This is an evidence of serious affection of the liver. Other associated symptoms that the patient may primarily present are liver tumors. All patients having end-stage liver disease or chronic liver disease for a long time are prone to develop liver tumors in the liver. This again requires assessment to control or downstage the tumors and then finally have a management plan for the liver tumors. Patients with liver disease can also present primarily with infections. Infections could be in the blood, in the chest, and the abdomen. This needs treatment in terms of hospitalization and antibiotic treatment.